Today we're going to start talking about antineoplastic chemotherapy agents. This is going to be really important about the treatment of cancer outside the surgical setting. There's a couple things I'll touch on that will be relevant to surgery, but overall this is more of a medical setting. Antineoplastic chemo agents, these help systematically treat primary or main tumors and their metastases. We'll talk about some terms, discuss some warning signs of cancer, talk about abnormal cell growth, classifications of antineoplastic agents. And then we'll also do a little bit about epidemiology, some nanotechnology talk, and new agents being researched for cancer therapy. So first up, let's talk about terminology a little bit. Cancer, also be called a carcinoma, or you might see it CA. Malignant also means cancerous, and neoplasm is a tumor. Benign means non-cancerous. Metastasis is the spread of disease. Antineoplastic agents, these inhibit or prevent growth or spread of malignant cells. Remission also means abatement, so stopping symptoms. It can also mean possible cure. Palliative means relief of symptoms, but no cure. It just makes the patient to feel better. And cytotoxic means it's toxic to cells. You'll see this in your book as well, but these are some of the 7 warning signs of cancer. These can be thought of as caution. So each letter in there is going to represent something. Change in bowel or bladder habits, a sore that will not heal, unusual bleeding or discharge, thickening or a lump in the breast, testicles, or elsewhere, indigestion or difficulty swallowing, obvious change in size, color, shape, or thickness of a wart, mole, or mouth sore, and nagging cough or hoarseness. Before cancer can start, a disruption has to occur that transforms normal cells into malignant ones. So this can be from internal factors like inherited gene mutations. You hear a lot of times of family history of breast cancer. That's kind of what that's talking about. Hormones and the strength of the immune system. And then there's also external factors that can cause cancer. These are things you can kind of choose to do or not to do, specifically use of tobacco, infectious organisms you might be exposed to, and then exposure to chemicals and radiation, and this does include sun exposure as well. There are types of abnormal cell growth. The primary site is going to be when normal body cells will divide and multiply, and this is the original site of the tumor where this happens. And then a secondary site, this is any new location of cancer after the primary site is found. So keep in mind tumors may be benign or malignant, and surgery may not be the only treatment available to the patient with cancer. Chemotherapy agents. So steroids and antiemetics are used along with antineoplastics to fight certain types of cancers and to help prevent nausea and vomiting. That's what those antiemetics are. We'll talk about these in a later chapter, but they help to prevent nausea and vomiting. These antineoplastic agents that fight cancer, they can be cytotoxic, so this means that they are going to harm normal cells as well as malignant ones. They're used for remission. They have palliative effects and or prolong life. And keep in mind they are contraindicated in pregnant patients and patients with renal or hepatic disorders. Another type of chemotherapy agents are alkylating medications. These are the largest group of anti-cancer agents. They are toxic to tissues that grow rapidly. They're going to be effective against many types of cancers, including acute and chronic leukemias, lymphomas, and solid tumors of the breast, ovaries, uterus, lungs, and stomach. Next are the oldest group of anti-cancer agents, antimetabolites. These agents disrupt the metabolic process. Some inhibit enzyme synthesis. Because these are used to prevent the neoplastic cell from dividing and they cause cancer cell death, They're used to treat lung cancer and breast cancer and even bladder and brain cancer. And you'll see a note on here about methotrexate. This is one of the few things that you might hear about in surgery related to chemotherapy agents. This can be used to treat ectopic pregnancies. Ectopic pregnancy is when the embryo implants outside of the uterus, typically in the fallopian tube. So the cells are going to multiply there, and it can become a big emergency situation. These patients can bleed to death if it's not treated appropriately. But sometimes if they know very early on that a patient has an ectopic pregnancy, they will give them methotrexate. This helps the cells not to multiply so quickly. So this is kind of a course of action that sometimes will prevent them from coming to surgery. So you'll find that interesting, hopefully. The next class of chemo agents are the mitotic inhibitors. These come from plant extracts, and they block cell division at a specific stage. Their uses include treatment of advanced breast and ovarian cancers, colon and lung cancers, and squamous cell cancers of the head and neck. The next class are the antineoplastic antibiotics. These differ from those used to treat infections in the fact that they're antibiotics. These are going to target specific types of cancer by inhibiting protein and RNA synthesis and binding DNA, which fragments cells. The first agent of this type was used to treat animal tumors in the 1940s. Today, these are going to be used to treat testicular cancer, Wilms tumors, and ovarian, lung, and bladder cancers. The final class of chemo agents we're going to talk about is hormones and hormone antagonists. These will include androgens and anti-androgens, estrogens and anti-estrogens, and progestins. These are used in combination therapy to treat various cancers. These act as antagonists that inhibit tumor cell growth and compete with endogenous hormones. For example, androgens promote the regression of breast tumors, so that can help with that condition. Hormone antagonists have beneficial effects by changing the hormonal environment that promotes cancer growth. Targeted therapy, this by scientists sometimes is called molecularly targeted drugs. This involves the use of drugs or other substances that interfere with specific molecules involved in a tumor's growth. The focus of anti-cancer drug development has been on this recently because they're kind of the cornerstone for precision medicine, targeting just the cells that you want to destroy and keeping the other cells intact and normal. Many have been approved by the FDA to treat specific types of cancers as well. Biologic response modifiers, these are also called BRMs. These boost or enhance the body's immune system, and sometimes they're used along with chemo agents. And these are kind of also still being investigated for different ways they can be used. Keep in mind that chemo agents do destroy cancer cells, but also the normal cells as well. So these BRMs have a couple functions that help with that. They help enhance the body's immunologic function, destroy or interfere with tumor activities, and promotes differentiation of stem cells. Further indications for BRMs or use are being investigated. Two agents here, erythropoietin and filgrastim, are used to treat chemotherapy side effects. This can help with anemia and to boost the immune system. Interferons and interleukins are other BRMs. They too have specific supportive effects. Interferon is used to treat Kaposi sarcoma. Gene therapy. So this is another experimental technique, and it's going to use genes to treat or prevent a disease. This started over 2 decades ago, but there were some patient deaths, so it slowed down progress a lot. Recently, though, there have been more medical advances to kind of help make this possible again. So really, a vehicle is needed to carry these good genes into the human cell. So they're kind of using viruses to try to do this and test out this theory. So they're hoping this will be the next big breakthrough. Whether or not that happens, who knows, and who knows how quickly it could happen. So we're going to talk a little bit about some terms here related to the cure for cancer. Epidemiology. This is the science of determining and influencing the frequency and distribution of a disease and its cause to find a cure. The epidemiology of cancer reflects patterns based on age, gender, geographic location, and socioeconomic status. Etiology, the definition of this is the cause of disease, and carcinogens are substances that cause cancer. You can see here a figure. These are called nanorobots. These may be used to patrol the bloodstream to look for unwanted pathogens. They're doing research on this as well. They're just super small particles. They can be used for diagnostic purposes, maybe to deliver medications and blood testing as well. Ongoing research on the enzyme telomerase. This is found in all cancers. So scientists are looking into this to decode and translate this enzyme. If scientists can actually see what telomerase looks like, maybe they can find a molecule that can turn off the damaging effects that it has on people. Customized drugs are being developed, so they're testing to see how well a patient's body can absorb certain drugs, such as tamoxifen, in the treatment of breast cancer. It can also be used to assist physicians in deciding which drugs work best for which patients, including dosage and side effects. Okay, and we're going to finish up our short lecture on this. Talk a little bit about tumor staging, just to remind you maybe the different stages of this. Tumors are going to be classified by how much they have invaded tissues and how much they have spread. So on this stage 0, this is going to be the cancer has stayed in place. It's cancer in situ. It hasn't moved yet into other tissues. The worst case scenario is going to be stage 4, where it has spread to other organs and parts of the body. This is going to be considered advanced or metastatic cancer. And then if you look at these, there are going to be a couple of different stages in between. When cancer can't be cured, anti-cancer agents can be used as a palliative treatment. Remember, this is just treating the symptoms, but not actually curing anything. And cancers that spread rapidly and have short cell replication cycle are the most affected by neoplastic agents. When they are taking a tumor out in surgery, sometimes they will have pathology to come look at the tumor. Actually, not sometimes, always. Those tumors are going to be looked at, but they can grade these tumors from grade X, where they can't actually assess them. Grade G1 means there are well-differentiated margins. So maybe you think of it as like a golf ball. You can have those very defined outline. And then after that, you can go all the way down to undifferentiated. So this is going to be high grade. Maybe you're not sure if you have the margins completely out. Maybe it's just so spread that there is no actual margin or outside of that tumor. And then let's see what else. This, you don't really need to worry about any of this. You can read over on your own. But hopefully this was informative. There's not going to be a lot of questions on the final about this chapter because it is not super related to surgery. But hopefully you learned a couple things and it was interesting to you. And I hope you guys have a great day.